Welcome to the Haematology EMQ SBA Teaching video. Today we're going to be going through a number of questions, looking at keywords and understanding what they mean. First question. A 20-year-old lady presents with recurrent infection and nosebleeds. She's just finished chemotherapy. What is the likely cause? So let's first identify the keywords. The keywords here are recurrent infection, nosebleeds and chemotherapy. When you see these words together, you should be thinking about aplastic anemia. Chemotherapy is a secondary cause of aplastic anemia. Aplastic anemia is a pancytopenia with a hypoplastic marrow. Pancytopenia is a reduction in red and white blood cells as well as platelets. This is why you get the bleeding and the infection. Chemotherapy drugs are renowned for side effects. So let's look at the classic chemotherapy drugs that you see in the exams, along with the side effects, their primary side effects. So bleomycin, busulfan and methotrexate classically give you pulmonary fibrosis. So this is also important in the OSCE. So if you see a patient who is taking methotrexate on their drug chart, you should be listening to their chest for fine inspiratory crackles. If you see vincristine, cisplatin or taxanes, you should be thinking about peripheral neuropathy. If you see cyclophosphamide, you should be thinking about hemorrhagic cystitis. And if you see doxorubicin, you should be thinking about cardiotoxicity. These are the classic chemotherapy drugs with their classic side effects.
The great thing about EMQ SBA exams is that you can do very well by using the right exam strategy. It's not about learning all of medicine, but about being strategic and learning what commonly comes up. First of all, it's good to know what to expect in the exam. You need to know how to put keywords together from the question in order to know what the diagnosis is. From those keywords, you also need to know what the first-line investigation or the first-line treatment is. You need to know how to be able to deduce which medication has been taken, then what the likely complication is of that intervention. These are the classical questions that come up for finals. Once you're able to recognize keywords and what they imply, you will fly through the exam.
Next question. A 25-year-old Greek man presents with anemia and jaundice that's worsening. After the incident, a blood film showed Heinz bodies. What is the likely cause? The keywords here are Greek, anemia, jaundice, and Heinz bodies. Glucose 6-phosphate dehydrogenase deficiency is a red blood cell enzyme defect. The keyword is Greek, as this happens in those of Mediterranean origin. G6PD leads to an oxidative crisis triggered by fava beans and drugs such as ciprofloxacin and sulfonamides. So these are more keywords that you're likely to see in the question. Heinz bodies are another key finding on the blood film as it represents oxidized hemoglobin. Let's go through some blood film keywords. So if you see these in your EMQ SBA, you should already know what the diagnosis is. So if you see the word target cells, you should be thinking about liver disease or iron deficiency anemia. With iron deficiency anemia, you may also see pencil cells. With reticulosis, you should be thinking about hemolysis or hemorrhage. If you see Burr cells, you should be thinking about uremia. If you see Heinz bodies, you should be thinking about G6PD deficiency, as we've just discussed. And if you see Howell-Jolly bodies, you should be thinking about hyposplenism. Next question. A 55-year-old woman presents with paresthesia, dyspnea and tiredness. On examination, she shows extensor plantars, brisk knee reflexes and absent ankle reflexes. The blood film shows macrocytic anemia. The keywords here are paresthesia, dyspnea, tiredness, reflexes and macrocytic anemia. So breathlessness, tiredness and peripheral neuropathy, and the blood film shows macrocytic anemia indicates pernicious anemia, a common cause of B12 deficiency. Pernicious anemia leads to a failure of intrinsic factor production. IF is needed to absorb B12. The treatment is parenteral vitamin B12. Neurological signs occur due to degeneration of the dorsal columns of the spinal cord. Vibration and joint position sense are affected early. Macrocytic anemia is a very popular question when it comes to EMQ and SBA exams. So let's go through classic keywords that you need to keep an eye out for. If someone has macrocytic anemia as well as thin, dry hair and slow relaxing reflexes, you should be thinking about hypothyroidism. If someone is taking drugs such as trimethoprim or phenytoin, you should be thinking about folate deficiency. If someone has peripheral neuropathy and glossitis, you should be thinking about vitamin B12 deficiency. Next question. A 30-year-old lady presents with painless enlarged lymph nodes in the neck. The blood film shows Reed-Sternberg cells. What is the likely cause? So again, the keywords here are painless enlarged lymph nodes and Reed-Sternberg. Reed-Sternberg cells equate to Hodgkin's lymphoma. So again, there are some classic keywords that you should be thinking about when it comes to hematology malignancy. If you see a very high white cell count, gout, and Philadelphia chromosome, you should be thinking about chronic myeloid leukemia. If you see our rods, you should be thinking about acute myeloid leukemia. And if you see bone pain, renal failure, monoclonal Ig bands on electrophoresis, or plasma cell infiltrate on bone marrow biopsy, you should be thinking about myeloma. So these are classic findings for these diagnoses.
With our accelerated revision strategy, you'll be given word recognition tables summarizing keywords and their diagnoses. You'll be given revision summary tables teaching you first-line investigations, first-line treatments, and drug complications. You'll have commonly examined high-yield facts at your fingertips, and you'll have plenty of EMQ and SBA practice, which is crucial for the exam. Over 3,000 final year medical students have passed with ACE Medicine. We will give you a money-back guarantee that you'll pass with us too. Hear what our students have to say about our finals course.
I think this course is great because it assesses your knowledge through use of questions, it keeps you focused on the material, it only covers what's completely relevant with the latest guidelines. The course had really enthusiastic presenters, there was the opportunity to ask questions at any point, it went through at a really good level, working out from the basics and more advanced stuff, and I recommend it to anyone actually. I think that it was really good value for money for what it was, and the notes that you get to take away are pretty comprehensive and will be an invaluable learning resource.
I think my favourite part of the whole course was just going through the MCQs and having them properly explained by someone who actually knows what people are looking for and the bits in an MCQ that you should are poignant that you should pay attention to. I think that it was great value for money for what it is. You get a hell of a lot in 2 days straight, which means that it condenses all your revision down into 2 days, so you can now go home and build upon it yourself.
I've just been to ACE Medicine course and it was brilliant. I was on it 2 days in Manchester, and it was the first course that I went to for written exams. It addressed all the major topics that come up in finals, and it taught me the thought process behind answering questions in multiple choice. Things that you don't really get taught elsewhere, and also it saved me a lot of time for revision, and I think I can target and focus my revision more and answer questions a lot better. So the course covered a lot of areas in medicine, and one of my favourite bits was neurology and endocrine and renal medicine. Not because I enjoyed these bits, but I think it kind of addressed, they were my weaker areas, and I feel like they've been addressed very, very well, and I've got a better understanding than I've had over the last 4 years. And I definitely think it's value for money. And I know a lot of people say don't go 2 days of courses, but I think this is one of the best courses. And yeah, so definitely come and join.
You can book your ACE the Medical Finals course place today, and you'll receive your pre-course revision pack immediately. Thank you for listening, and good luck.